Hello everyone, my name is Murad, welcome to my channel, thank you for watching me, and today I want to talk with you about some hot topic in this world and in nowadays, and about coronavirus. But I want to talk about another thing, like I have one article it's was posted in October 24th of 2017, and you will see in description the link for this post. I think it was from Washington Post, kind of that, but you will see it in description. And the topic is world leaders rehearse for a pandemic that will come sooner than we expect. And again, it was in October 24th, 2017, and posted by Lena H. Sun, and she is national reporter focusing on health. And I will read it for you, some information in this article. So they're telling they explain they're doing simulation of, or they did simulation, and maybe they talk in that meeting what will happen and what they will do if the world will have pandemic. So the government ministers were facing a new infectious disease outbreak. The mysterious virus was seeking and killing people with alarming speed. Kind of we see now. Some patients had to be placed on ventilators to help them to breathe. What we see now, same with ventilators, like now Trump told a lot of like maybe Trump, yeah, and some I heard like Volkswagen or like GM, some brand like automaker, they doing now. They will start to produce ventilators to help to people in this situation. So the new virus seemed resistant to antiviral medicine. Within a week, officials had closed a major hospital and schools and quarantined thousands of people. Quarantined, yeah. Fear and panic spread quickly as people in neighboring countries became infected and died. Like, in my opinion, they know it can happen. It will happen in future. The scenario was part of pandemic simulation held during the World Bank annual meeting in Washington this month. So it was in October 24th, like in October in 2017, like more than 2 years ago. And it's not the kind of event that people would typically associate with World Bank. Outbreaks of life-threatening infection disease are spreading faster and with more unpredictable than ever. Like, they doing this simulation, they talking about that, and I found that this meeting they didn't allow or they didn't record to for video, so miles of people cannot see the video exactly what was there and about what they took. And next, for the World Bank simulation organizer looked at the impact of travel and tourism of an outbreak of mysterious respiratory virus in a hypothetical country. Participants included finance, health, and tourism ministers from about a dozen countries, and officials from organizations include the World Health Organization, the Center for Disease Control and Prevention, and International Air Transport Association. The discussion during the 90-minute session were off the record, but in the interview after the event, organizer said the step-by-step scenario made the theoretical possibility seem very real for participants. So they knew about that, and how we see now our world is not prepared for this like kind of scenario what we see now for pandemic, for epidemic, whatever how it's calling, like for this crazy stuff when the countries now is like lockdown, like people dying and spreading this virus to, and every day in UK thousand people. In my question, if they knew about that, maybe they should to prepare more deeply, and they know, like like I understand they all prepared, they have all scenarios, what will be, what we will do in that situation. They're doing that step by step, everything. But exactly for today, nowadays, but they can prepare it much better than we have now. Like in Italy, they have like medical collapse kind of, but I'm not sure they have or not. But when you're reading some like articles, some news everywhere, they're telling like kind of collapse because have a lot of people who get sick and they don't have space in the hospitals, don't have a lot of like doctors, nurse, because the nurse sick too. And this is a problem for everyone and for a lot of countries. mm, uh, Made this kind, and they made a fourth or fifth time this kind of simulation. I don't know what kind of simulation was before they did same or not, but they did it. So and next one. In today's fast-paced world, information flows through the unofficial channels much faster than through official ones, said Ron Klein. The government officials need to be more in sync with that and adjust to that, Klein said. Officials who rely on once-a-day updates in outbreak situation need to understand the importance of realizing accurate information in real time. I think the exercise clearly reflected that. The ministers and others really focused on that, he said. Participants in the simulation were shown hypothetical social media posts. One news story about the cruise ship passenger who worked in a lab researching the virus was seen by thousands of people within a minute of being posted on Instagram. So they did different kind of simulation even in social media. The World Bank conducted its first pandemic simulation for finance ministers at this annual meeting last year. In January, the bank and the Bill and Melinda Gates Foundation hosted another simulation for chief executives for major companies at the World Economic Forum annual meeting in Davos, Switzerland in January. In July, they worked with German Chancellor Angela Merkel to conduct a pandemic simulation for health ministers at G20 governments meeting, which traditionally focus on finance and economics. Like, it really is interesting. In the past, some countries have been reluctant to publicize outbreaks or delay reporting them because of politics or worries about tourism and trade. In countries depends on the tourism, there is also political economical pressure to take action to that may turn out to be counterproductive for their economies, said Ryan Morhart, project lead for global health security in the World Economic Forum, which helped organize the World Bank simulation. Like, also at the end, I will give you another one more information. What was before this? What World Bank did it? Like, it's interesting too. Although there is more awareness about the issue, experts agree the world is not prepared for next pandemic. We still are not ready for the big one, Klein said. Nothing that next year in the centennial of great influenza pandemic of 1918-1919 that killed at least 50 million people worldwide. We are frankly not ready for a medium-sized one. The threat is still out there. So they knew about that. They knew that they not ready for any kind of even medium size of pandemic. We don't know if this pandemic is really medium, high, low, like whatever. How is calling the pandemic? Because like thousands of people now dying. I don't know like how many people died for today, but like I heard that for today's 21st of March and Italy like in Italy died more than in China, but this virus started, I think, in China. The telling like in China, in Wuhan city, but now in China the cases is now like Italy coming up, and soon with death is surpass the China, and maybe it will surpass with new cases, and Italy and Spain too, and even in US it's a lot more. It surpassed I think like maybe 10,000, or it's going like rapidly high. But also it can be the problem with that testing, because a lot of people, if even they will sick, if they will feel bad, maybe sometime like they will afraid to go, or even they don't have money. Like yeah, I heard that Trump, they signed like helping to make that test case for free for American, but in a lot of countries not free, I think so, but I'm not sure. And not everyone will go to test it, and even now they tell only who have a hard time, who have not only just if you have like sick, you have a little bit high like you have fever like that, they tell them don't like really, if you feel bad but not so bad, don't need to go there, because they have like limit of the test, and they need to help to that people who really need, who really sick, or who really feel bad even they cannot walk, because pneumonia, this the problem with lung, is really bad thing even without this pandemic, without this virus, with this virus making this kind of illness. And like I told you before, like I will tell you another one. It was article, it's interesting article. It was in June 28th of 2017, so like June, like July, August, September, October, 4 months before this meeting. World Bank launches first ever pandemic bonds to support 500 million pandemic emergency financing facility. So like what they did, they had like PEF, like PIF. The PF covers 6 viruses that are most likely to cause a pandemic. This includes new artomyxoviruses, like new influenza pandemic virus A. Like I don't know what is it. I'm just reading for you. CoronaVirus is SARS or MERS. So I've tried to find in Wikipedia what is coronavirus. So this one is still like I understand is coronavirus. Maybe it have another kind of name of that coronavirus, because if they will do coronavirus, maybe it will be like a little bit more harder than coronavirus. And also filoviridae, I don't know. It's from Ebola, Marburg, and other zoonotic disease like Crimean Congo, Rift Valley, Lassa fever. Now, like can you understand that they did launch this PIF? So the PIF financing is eligible countries will be triggered when an outbreak reaches predetermined levels of contagion, including number of deaths, the speed of the spread of the disease, and whether the disease cross international borders. Determination for the trigger are made based on publicly available data as reported by the World Health Organization. They predict they they was preparing for this one. I don't know. Like I'm in my opinion, World Bank they prepare the first. They put these bonds for 500 million. Well, it was like when I read it, first it was like for 425 million bucks, and after that they maybe the rise because a lot of Canada they bought it. Also German they bought it for 15 million, something like that. But yeah, you will see the article. You can read it. If you want to know more carefully, everything you will be included in the description. So further they push these bonds. After 4 months, they simulate, like first time they simulate the pandemic situation, like when virus coming, pandemic virus with breathing, the problem with breathing. It's interesting. Like if they knew about that, why they all like countries or World Health Organization or whatever CDC, they should prepare much more careful, like much better than what we see now. Well, a lot of countries they don't have. It's okay. Maybe you can we can talk about some countries like who not so kind of rich. Maybe you can say who don't so like should be. I don't want to say. I don't want to name that countries, but have some country who maybe they don't have in their budget when they can spend money for preparation for this kind of situation, so they don't have extra money. But some countries like in Europe, Western countries, they can't prepare for this. They can buy upfront a lot of stuff, because we see now, like China, they didn't have, all countries help to China now, like in Italy they have problems, like US, now like all companies helping, they producing that mask, this breathing, how to say that, ventilators. Yeah, sorry, they may producing the ventilators, everything, because in some countries like UK, I read about that they have only around 5,000 ventilators, and in next 2 weeks maybe they will need around 30,000. Like, wow, it's 5,000 for all country, 5,000 ventilators. You can produce that ventilators like 550, 100,000. Yeah, and just put it, like, take care about them, maybe put it in that box with no humidity, and there's a special condition, and they will not destroy by time, they will not, it won't happen something, because it's like really now it's all world have this, like Trump told that we have war with this virus. Yeah, this kind of stuff. And now it's panic for all people buying this mask, buying the gloves, buy the, like, sold everything, but like a lot of scientists telling the mask won't help to you. So like it's interesting, like I don't want to tell something like, wow, it's something they knew, they did something. No, I'm telling about that they maybe they predict, they thought it can happen, but we didn't prepare for this. Even they knew about that more than 2 years ago, that the world is not ready for even mid-size of pandemic, any kind of virus, but not any kind of virus, this special kind of virus they're talking about. Some patients had to be placed on ventilators to help them to breathe. So they exactly, I think, knew about what kind of problem they will have in future. So thank you for watching me. I don't want to make you panic. Please don't panic in this situation. If you will panic, your immune system will go down, and you can get not only coronavirus and the pneumonia. No, you can get a lot of different kind of stuff. You have problems. So just be positive. Listen what government telling. Social distancing, like wash your hands, like, and a lot of this stuff. Don't make, like, we're reading now news, a lot of young students, they're going to the beach, they don't care about this situation, don't listen government. Yeah, maybe they're young, they can, maybe if they will get sick, they won't know that they will sick, and everything will go through them very easy, and they will never understand that. But they will go to see their grandparents, parents, and maybe they can bring this virus to that home. And we don't want to spread this virus to all the world, like it's all already, but not all of the people. And so take care, be safe, and try to listen government at this situation, and don't make mistakes what we have now in, like, Europe, some countries. Wish you good luck, be safe, and everything will be good. Just be more positive, and everything will be fine. Thank you. And also, if it will be easier for you, can you smash like button, subscribe to my channel? I will find some new information about this situation. Also, I have one another article about this virus, and you will see in next video. Thank you. Bye.